All right, so today we're diving deep into a topic that I think a lot of people might be curious about, and that's the difference between OxyContin and oxycodone.
Yeah, these are two medications that get talked about a lot, especially with, the opioid crisis and everything.
Exactly, and it's easy to think, oh, they sound basically the same, they're probably the same.
Right.
But as we'll see, they are not the same.
No, they are definitely not.
There are some really important distinctions, and that's what we're going to be unpacking today. And our guide for this deep dive is a really fascinating article, I thought, from Rolling Hills Recovery Center.
Yeah, they're a rehab facility, so they've got, really, they're working on the front lines of this.
Yeah, we see it all.
They see it all.
So they've got some real experience with this, and, I think they do a good job in this article of really laying out the complexities. So,
Yeah.
I think a good place to start would be to kind of define our terms here. As you said, these names sound very similar. OxyContin, oxycodone. What exactly are we talking about here?
Right. So both of these medications, the active ingredient in both is oxycodone hydrochloride.
Okay.
And that's really the part of it that's doing the pain management.
Okay, so if they have the same active ingredient, why do they have different names?
Yeah, that's the thing, is it's not about what's in it so much as how that ingredient is released into your system.
Oh, okay.
So you can kind of think of it like if you're watering plants, you can either,
Right.
dump a bunch of water on them all at once, or you can use like a slow release system.
Right.
So it's the same, it's water either way, but it's getting to the plant differently.
Okay, so in this analogy, which one is oxycodone? Just like the straight,
Probably. That would be like your immediate release.
Yeah.
So that's going to kick in faster. You'll feel the effects more quickly.
So like 10, 20 minutes, you're saying?
Yeah, something like that. Yeah, 10 to 30 minutes typically.
So then OxyContin is the slow release.
Exactly, yeah.
Yeah.
Oxycontin is formulated to last for like 12 hours.
Oh, wow.
So it's
Yeah.
a much slower, steadier release of that same ingredient.
Okay, so that makes sense why they would have two different, formulations. So what are the situations where you might be prescribed one versus the other?
So they're both prescribed for pain management. And really it can be moderate to severe pain.
Mm-hmm.
So, we're talking anything from like, recovering from surgery to, chronic conditions.
Okay, so like arthritis, back pain, things like that.
Absolutely, yeah. Chronic pain, cancer patients.
Mhm.
It runs the gamut.
And that's where we get into, I think, the real, this is where the article really stressed the importance of understanding the difference between these two drugs, because it's not just about how quickly they act, it's also about the risks that are associated with them.
Absolutely. And, this is where the way the drug is released becomes really important.
Yeah.
Because when you have something like OxyContin that's extended release, while it's great for long-lasting pain relief, it also makes it easier to misuse.
Because people will crush it up to get that, like to bypass the slow release and get the full effect.
Exactly. So people will crush it up, and that'll give them a very sudden, very powerful high.
And that's very dangerous.
Incredibly dangerous, and it's highly addictive. So that's a big part of why OxyContin has been, really at the center of this opioid crisis that we've been facing.
Right, because if you have oxycodone, you're already getting that quick release, so it's not as, I don't know, I guess abusable isn't the right word, but it's not as...
It's not as easy to misuse in the same way.
Right.
Yeah, and I think it really highlights the fact that it's not just about like what a drug does, it's about how it does it.
Right.
And how that can really impact, the potential for harm.
And speaking of harm, we do have to talk about the side effects. And this article does not sugarcoat it.
No, they don't.
We're talking about a range of side effects with both OxyContin and oxycodone. So even if you're taking these medications as prescribed, there's still, you should be aware of the potential side effects.
Absolutely. And some of the more common ones that you might experience are things like constipation, maybe some nausea, dizziness.
And it's not just, feeling a little nauseous.
Yeah.
We're talking about some potentially serious stuff here.
Right.
The article mentions slowed breathing, especially at higher doses. And that can be life-threatening.
Absolutely. And that risk is even higher if you're combining these medications with other things, especially alcohol or other medications that, depress the central nervous system.
Right. It's like, 1 + 1 = 3 in those situations. It's not just, oh, I'll be a little bit more sleepy. This is serious stuff.
It can be very dangerous.
So again, this is why it's so important to be talking to your doctor.
Yes.
Be honest with your doctor about what you're taking, what your medical history is, any concerns you have.
Absolutely.
Because knowledge is power here.
Exactly. And, speaking of, things to be aware of and things to be talking to your doctor about. This article does a really good job, I thought, of going over the warning signs of opioid addiction.
Yeah, and it's not always as obvious as you might think.
Right.
It's not always somebody who's like, passed out on the street corner. It can be a lot more subtle than that.
Absolutely. And it can happen, to anyone. It doesn't matter your background, your age, your social status, whatever.
Right.
Addiction can affect anyone.
And I think there's still, unfortunately, a lot of stigma around addiction.
Yes.
People thinking, oh, it's a moral failing or something like that. And this article really stresses that it's not. Addiction is a medical condition.
It is. It's a disease.
Yeah, and it needs to be treated as such.
Absolutely.
So, it was interesting. They gave some examples of behaviors that people might exhibit if they're struggling with addiction.
Oh, yeah.
And, some of them are things that you might not even think twice about, like doctor shopping, trying to get multiple prescriptions from different doctors.
Right.
Or even, hate to say it, but stealing medication from friends or family members.
Yeah.
So these things can fly under the radar.
It can.
And then there are the kind of, I guess you could say, the more physical signs, like changes in behavior, sudden weight loss, changes in their sleep patterns, neglecting their responsibilities. So if you're noticing these kinds of things in yourself or in someone you love, it's really important to reach out for help.
It is. And that can be a really hard step.
Oh, absolutely.
Admitting you need help is huge.
Yeah.
But it's so important.
And that's where, thank goodness there are resources available.
There are.
And this article from Rolling Hills Recovery Center, they do a really good job, I think, of kind of laying out what some of those treatment options are. Obviously they have a dog in this fight being a rehab facility.
Yeah.
But I still thought it was really valuable information that they shared.
Yeah, and it's good to know what's out there,
Right.
because it can be overwhelming trying to figure out where to turn for help.
Absolutely. So, they talk about different therapies like cognitive behavioral therapy. Yeah. Which helps people kind of, I guess, change their thinking around their addiction.
Thought patterns and their behaviors.
Right.
That contribute to the addiction.
And then there's also the support groups, which I think are so important.
Oh, absolutely.
That peer support, realizing that you're not alone in this.
Right. That you're not the only one going through this.
And I think what I really appreciate about how they approach this, at least how they describe their approach in this article, is they don't sugarcoat it.
No.
They're not like, oh, come to our facility for a week and you'll be cured. It's not like that.
It's not a quick fix.
It's a process, right?
It is. It's a journey.
And it takes time, and there are going to be ups and downs, and you need that ongoing support. So we've talked about, the differences between these two drugs, the risks, the potential for addiction, the treatment options. But I want to go back to something we touched on earlier, and that's the long-term impact these medications can have on your body. We talk a lot about the risk of overdose, and that's obviously a huge concern.
Right.
But what we don't always think about as much is the long-term damage that these medications can do, especially to organs like the liver and kidneys.
Yeah, that's a really important point, and I think you're right. It often gets overlooked because it's not as immediate,
Right.
It's not like, I took this pill and now I'm, having this immediate problem. It's something that can build up over time.
It's insidious, yeah.
Exactly.
And it's interesting because, with OxyContin, because it's in your system for longer, that could potentially increase the risk of those long-term effects.
That's right. Yeah, because your body's exposed to the drug for a longer period of time.
So it's not a free lunch, right?
Exactly.
There's always a trade-off.
There is. And it's about, weighing those risks and benefits very carefully.
And that's why it's so important to have, like we were saying before, that open communication with your doctor.
Absolutely.
Because they can help you weigh those risks and benefits.
They're the experts.
Right.
They know your medical history.
Right.
They know what other medications you're taking.
Right. They can look at the whole picture.
Exactly. It's not a one-size-fits-all situation.
So maybe, just maybe, this deep dive will make people think twice about those quick fix solutions for pain, because it's not always that simple.
Yeah, I think that's a great takeaway.
Pain management is complicated.
It is. It's a journey. It's not a destination,
And it might take some trial and error.
It might, and it might take some patience.
And it might take advocating for yourself,
Absolutely. Being your own best advocate.
So we've covered a lot today.
We have.
We've talked about the sciencey stuff. We've talked about the human side of it.
Yeah, the real life implications.
And I think the big takeaway here is knowledge is power.
Absolutely.
The more you know about these medications, the more you understand the risks, the benefits, the better equipped you are to make decisions about your own health.
Couldn't agree more.
And for those of you who want to learn even more, we will link to that article from Rolling Hills Recovery Center in our show notes.
It's a great resource.
It really is. It's very insightful.
So yeah, keep asking questions. Stay curious.
And until next time, thanks for joining us for this deep dive.
Take care, everybody.